The DSM describes that about 5% of children have ADHD, although other studies in the United States have estimated higher rates. And in a 2016 report, the CDC described that 5.2% of children 2 to 17 are taking ADHD medications that are diagnosed with ADHD, and about 62% of those take medications, where only 47% are receiving some sort of behavioral treatment. As a part of that, we're going to talk about some of the best practices for treatment by clinicians at home, in school, and just in a community mental health setting. As we kind of go about this, we're going to really look at an article that was published by the Journal of Pediatrics in 2011. It's written by a subcommittee on ADHD, and it's the steering committee for quality improvement and management in mental health services. This article focuses on diagnosis, evaluation, and treatment, but we're just going to really look into how does ADHD get addressed in those settings, by practitioners, by people at home, and in schools. According to the article published by the Journal of Pediatrics in 2011, behavioral interventions might help families of children with hyperactive and impulsive behaviors that do not meet the full diagnostic criteria. So really, as we're going through and thinking about this and looking at kind of the tools that we're going to talk about today, while these do work for people who are diagnosed with ADHD, they can also be beneficial for other persons. And I wanted to start off our discussion today by talking about practitioners and kind of what, especially in a community mental health setting, can be done. So in thinking about medications, or thinking about ADHD, medications tends to be one of the most commonly thought about treatment methods. And there are a number of different types of medications that get used, most of which are stimulants, and some are not. And really, people have different feelings and opinions about medications, and my goal today is not to encourage parents or people with ADHD to come and to take medications, but just to talk a little bit about what that means and what that looks like, and to kind of share some considerations about them. So when ADHD is being treated by a medical doctor, their recourse and kind of the most frequent method of treatment that happens is frequently the use of medications. And oftentimes these medications are stimulants. There are things like Strattera and other medications that can be prescribed that are non-stimulant medications meant to address the symptomology of ADHD. But most of them do tend to be stimulants. They, some of them do not require therapeutic levels, and this is especially true for the stimulant versions of medication. So when you talk about Adderall, ADHD, I find it's very common for families to start and stop those medications, and they do not have to build up into a therapeutic level to be effective and useful. You should talk to your doctor. Of course, I'm not encouraging you to start and stop taking medications, but that has been kind of my experience. And so that not having to build up for a month or for a longer period of time lets families be able to use them, especially at school or in settings where it's really more problematic that their symptoms are coming and causing difficulties for that child. And finally, a lot of ADHD medications are prescribed by their primary care physician. Those primary care physicians are able to come and to prescribe those, and it doesn't require seeing a psychiatrist or some sort of a specialist. But really, when we do think about medications, that especially if a youth or an adult has severe ADHD and the symptoms are problematic at school, at home, across settings, that really the best practice is to pair the service with behavioral therapy supports, and to be able to address those needs. And so to talk a little bit about what kind of behavior therapy is, it represents a broad set of specific interventions that have a common goal of modifying physical and social environment to alter and change behavior. And really, some of these techniques, there's a number of different techniques. This is not an exhaustive list of techniques or how to actually implement them, but to give you kind of a broad overview in each of these arenas. And so these clinicians will use techniques to modify behavior, especially for parents, and to teach how to regulate their own behavior for the child. So they might come and teach the parents how to come and to implement some sort of system or to address the needs of their child. And then work with the child individually to come and to help regulate their own behavior. And it's very focused, and the best practices in all of the literature show, especially when you're working with teens, and especially in regards to ADHD, that there needs to be a focus in that work on parent education, that teaching, especially for young children, that teaching parents skills and being able to deal with their children is very important and is really fundamental to causing change. That a lot of times this behavior therapy focuses on kind of the basics of behavior modification. So there's kind of this idea of an applied behavioral analysis process looking at what's the things that are happening right before the behavior, what happens during the behavior, what happens after, how is it connected, kind of looking at positive negative reinforcement and positive and negative punishment, right? This idea and concept around operant conditioning. And or using other strategies, teaching how to use planned ignoring, or how to come and to start with smaller expectations and to expand those expectations as going through and as the child comes and grows and develops. And then finally, a lot of the services, especially the services focused directly on children, are on teaching the basics of self-regulation skills, how to self-assure, how to come and to increase self-worth. A lot of youth who are diagnosed with ADHD have feelings of worthlessness and that they aren't able to be successful. How to teach calming strategies, how to come and to re-regulate our bodies, how to change our thoughts and actions kind of through this CBT model, improving perceived self-worth. All of those things are really vital and are things that are often taught to children specifically with ADHD. And so it's really important for clinicians to be focusing and kind of on this aspect of home, school, and their services. And really, like, that vital focus is where all of those parts meet, which is where that child is. And so that practitioner should be coming and helping to coordinate services, helping to come and to bridge gaps, to make sure that any kind of barriers to treatment or services are able to come and to move forward. and to help coordinate that. So kind of the next thing we want to focus on is this idea of home and what it looks like at home. And so, you know, again, this is not none of these are exhaustive lists, but there are some things that we want to think about, and some ways that kind of both behavior modification practices can be implemented at home. So one way is this idea of behavior modification techniques. And again, we talked a little bit about this idea of operant conditioning and rewarding behavior that we want to see, either through positive or negative rewards, or the way that the literature talks about this is punishing. It's not kind of my favorite word for it, but that we can come and punish behavior that we don't want to see. And so offering rewards, having a chore chart, making sure that children are involved in structured activity can all be really beneficial in helping address ADHD at home. As well, the research shows us that having the child be able to participate in role play activities, even facilitated, whether that's being facilitated by clinicians, that's something that a lot of treatment approaches have in working with ADHD, is doing role playing, and that's some of the best practices at school as well. But at home, parents can come and role play with their child. They can come and have them act out scenarios that the child has struggled in, so that they can gain the skills necessary. So that's just a couple of things that parents can do at home. Kind of the last area that we want to focus on is kind of what can be done at school. And again, this is not an exhaustive list, but classroom modification and adaptation is a really important way that ADHD gets addressed at school. Oftentimes this is a part of the student either being on a 504 plan or being on an IEP, an individualized education program. And so this might mean that the student goes to a different location when the test is being given, or being given more time, or having the ability to have some of the questions read out loud, or things to help limit stimulation. A lot of times youth with ADHD struggle with being overstimulated. Another thing that can happen in schools, especially through an IEP, is having specially designed instruction. And so sometimes schools will teach self-regulation skills, will teach how to come and to cope, and how to come and to deal with these things. And so this is really beneficial. And then finally, schools can come and use behavior modification techniques the same way the clinicians teach that parents should be implementing, that schools can implement that. And a lot of times this is through having consistent practices. A lot of schools use RTI or a PBIS model to offer incentives and rewards for positive behavior. This might be through things like planned ignoring behavior, or having some sort of a penny chart, but all of those are beneficial ways to come and to address needs. And so I really hope that you enjoyed this video, and if you found it useful, tap that like and subscribe button. And I want to leave you with a question. If you or somebody that you know has struggled with ADHD, what has worked for them, or what has supported them or you? So go ahead and put your comments below, and thank you much. Bye. See you next time.